Hello, everybody. My name is René Najera. I am the Director of Public Health for the College of Physicians of Philadelphia, and I'm also the editor of the History Vaccines Project at the college. Today, I am talking to Rob Port, a columnist from North Dakota. He is a pioneer in political blogging there, founding the SayAnythingBlog.com in 2003. Since then, he's worked in talk radio and published print columns as well. Currently, he publishes digital and print columns for the Forum News Service and also hosts a Plain Talk podcast. You can find them on Twitter at Rob Port. Rob, thank you for joining me today. I read your column the other day, and that's when I reached out. I think it's very interesting what you had to point out about vaccine hesitancy and vaccination rates in North Dakota. Can you tell us a little bit about it?
Yeah, so obviously, like the rest of the world, we came through the COVID-19 pandemic, and there was a lot of hard and my point of view is political. I mean, that's my beat in North Dakota is the political. So, but part of politics, I think, is obviously the interchange between public policy and human behavior. And so what's been interesting to me is to watch what the pandemic and what I would call the political fight over the COVID-19 vaccine, what the downstream impacts that has been on vaccines that really had nothing to do with the pandemic or anything like that. So in North Dakota, what we're seeing actually is, and what we've actually had on the books for some time is we have required vaccines, like I think most places do, at least in the United States, have required vaccines to attend school. But I'm doing the air quotes around required because they're not really required, because if you don't want to do it, I think it's just a form that you have to fill out and say, I have a personal belief exemption, I have a religious exemption. I'm not sure why those are two distinct categories in the data in North Dakota, but they are. Or I have a medical exemption, which I think actually requires a note from a doctor. But pretty much, if you don't want your kids to get the vaccines, you don't have to. You fill out a form, say, I don't want my kids to have them, they don't get them. That's increasing by quite a bit. Those numbers of exemptions have gone up significantly. Interestingly, over the last, I think, 5-6 years, the number of medical exemptions has gone down. And there weren't that many to begin with, so we're dealing with small numbers. But they went down, but the number of voluntary opt-outs have gone up. And the vaccines that we're talking about, this really interested me, are the polio vaccine, the measles vaccine. It's vaccines that the generations of North Dakotans, generations of Americans have received with really no issues. I got them all when I went through school. My children have gotten them all. These aren't issues, but it was really interesting to me to see what I perceive as the political ramifications of the fight over COVID-19 having an impact on these other vaccines. The COVID-19 vaccine is not required for North Dakota. It's not one of those that are even tracked by the Department of Health for school-age children, or at least not tracked traditionally. Maybe they do have the data somewhere, but that's not even one of the required vaccines to attend school in the state of North Dakota. So the pandemic and COVID really has nothing to do with this. This is just straight up increased vaccine skepticism.
And of course, you talked about the political nature. In the US, public health is very political because the public policy on public health is set by politicians. And so that's just the system that we live under. Other countries have a more centralized public health. Here we have 50 plus states and territories who set their own agenda on public health, and vaccines are one of those. Do you notice, and I think I know the answer to this, but I'm just going to leave it up to you, there in North Dakota, the political leanings of those who are more vaccine hesitant than others?
Well, it's actually kind of hard to discern sometimes, because there's in politics we talk about what's called the horseshoe effect. And it's where if you get, we tend to think of politics linearly, and this is so reductive even to begin with, the linear right left.
There's more than one axis, right?
Politics is more complicated than that. There's like 4 dimensions, right? It's complicated. but to the extent that that's valid, we talk about a horseshoe effect, where once you get out on the margins, they're not so much far away from each other. They start circling back and they're getting very close. But I would say, yes, it's in North Dakota specifically, it's probably a lot of very, very right-leaning people. But there's also people who lean pretty left, who I would say are gosh, I'm trying to think of terms that aren't epithets for, kind of the granola eaters, maybe the hippie, or they're more kind of leftish. But there's definitely, on the fringes, there's a lot. Now, I want to be clear. The number of exemptions is about 5% all in, including the medical exemptions. But the medical are a tiny minority of the opt-outs. So we're still talking about 95% of people who aren't opting out. Although there is another 1 to 2%. If you look in the data, they're not specifically mentioned. They're non-compliant, but they also didn't file an opt-out. So you have another probably 1 to 2%, or maybe even up close to 3%, depending on which vaccine you're talking about, where if you look at the vaccine coverage rate versus the opt-outs, those are people who are just non-compliant, and there's really no teeth in the law to make them compliant. I'm not aware of any school district that's saying, no, your kid can't come. What the Department of Health is saying, well, we're reminding them, we're sending out and I understand the position that they're in. Like, you're going to not let that child be educated, because their parents won't get it. I mean, that's a tough call to make. So, but with even within the data, there's another 2%. Most people, though, are still getting vaccinated. They're still getting these vaccines, but there is a growing minority that aren't.
Yeah, and that is an important thing to point out that, yeah, the overwhelming majority of parents are getting their children vaccinated on time, according to the recommended schedule. Some are delaying it out of their own concerns, but they're still vaccinating, right? They're a little bit hesitant to do, too many too soon, as they call it, but they still do it. And then you have the ones who are completely not vaccinating and they choose these ways of getting around it. But it's important for diseases like measles, right? Very infectious disease, so we need that very high level of vaccination. I think I saw another column from you back in 2019 talking about measles and the increase back then that we had seen. I have not looked into North Dakota, but are you seeing any outbreaks or any cases of measles or other such vaccine preventables there?
I haven't looked at the data since 2019. So that's, going on 4 years ago. I've heard anecdotes where people are saying we've had outbreaks. I haven't looked specifically, so I can't speak to the updated data. I know at 1.4, and that's interesting too, because 2019 was pre pandemic. And I remember even tracking the opt outs back then. There was a growing skepticism of vaccines even back then, a lot of it coming from, certain celebrities were coming out as anti-vaccination. You had quote unquote documentaries, tying vaccines to like autism and things like that, which are just not true. But the advent of the internet, in addition to convincing people of all sorts of crazy things like the earth is flat and everything else, has also sort of turned a small minority, but a very vocal and very active minority, has turned them against vaccines. And that's really unfortunate.
And finally, do you see anything in the state legislature as far as vaccine policy? Any bills coming up or recently debated?
Our legislature was just completed. Probably the one bill that I would call totally anti-vaccine. It would have banned mRNA vaccines from any mammal, I think, was actually what the law said, which actually got some pushback from like ranchers, right? North Dakota's an agriculture state. So they were like, ranchers are like, hey, wait a minute, what are you doing to us? But that bill failed. So we already had very loose vaccine laws to begin with. So I mean, there really wasn't a lot of places to go. If we're talking about the larger issue of the pandemic, I think, politically, I don't know what the law can do. Like, I very much want people to get vaccinated to protect themselves and to protect our communities. But, I think it's got to be a choice thing. And we live in a time, and this is me sort of, again, looking at this from a political perspective, but the political perspective is the important one because it's about human behavior. We need Americans, we need North Dakotans to choose to get vaccinated. I don't think any policy that tries to force them is ever going to work. Somehow we have to win back some hearts and minds
Mhm.
on this stuff. And, that's tough with the pandemic we went through. I mean, there was some stuff that went on. We saw sort of the way, Anthony Fauci nationally, who I think a lot of the attacks on him were absurd and unfair, but also on the other side, sort of fetishizing him almost and turning him into this like godlike figure. I don't think that was helpful. I don't think it was helpful when we saw a lot of public policy experts say that the Sturgis motorcycle rally in South Dakota was a super spreader event, a tantamount to murdering people. But then a few weeks later, we have people doing social justice protests in the streets, and those were fine. That's tough stuff to swallow. I mean, that makes it seem like this stuff's being driven by politics, and that foments distrust. This is a subset of a larger problem we have with Americans losing faith in institutions. The public health and the academic world is just one of those institutions. This is a very important part of the crisis, but it is a larger crisis.
Yeah, it certainly is complex. And, just going at it from the historical point of view, we've seen this before. It's just that now social media and the quick access to information and things like, Twitter and Facebook that amplify certain ideas and certain messages really are something new that we have to contend with as a species, I think. But it's good to know, on the one hand, that you have this majority of people who are still vaccinating.
Yeah,
And like you said, we can get through to people based on changes in habits. We've seen what has happened with smoking, with seatbelts, etc. You know, they're not controversial anymore, but it's going to take a while to
it takes
get there.
time.
So,
Yeah, it takes time.
yeah. Yeah, we'll see what happens. Thank you so much, Rob, for joining us today. I really appreciate it. Go check out his opinion columns and his Twitter. Very good follow. Thank you so much. And we'll see you again next time when we talk more about the history of vaccines.